philosophy of nursing, I had the blessing of being part of making those words to paper. But those words to paper are also words that we live by.
Honestly, my favorite thing about working at Children's Hospital San Antonio, to me, it's hard to narrow that down because there's actually a lot of them. I think it's really the spirit and kind of the esprit de corps that we all feel related to our mission, and the really unique service I think that we provide to the children and families in San Antonio as really the only full-service freestanding children's hospital that kind of takes all comers. That's what I love about being here.
We're fortunate that we go out into the needy communities of San Antonio and we provide free healthcare services.
You know, we're invited into people's lives, and just strangers' lives at their absolute most vulnerable time, particularly if you're talking about parents and a sick child. I can't imagine a more frightening time for a family. And so for them to kind of give themselves over to us in a trusting way, I saw that as, you know, for me, that became like a covenant. I felt like that we really have a covenant. We have a covenant to do everything we can possibly do for our families and our children at every turn. Really our obligation as advocates. Nurses have an obligation to be advocates for
The way that I incorporate the nursing philosophies by truly showing our families compassion. I think it's really important that when we care for families, you can show them that we care for what they're going through, and we really feel in a way the pain that they are dealing with.
Other ways we incorporate the nursing philosophy in the emergency room is we have to be very compassionate, sympathetic to the patients and their families by letting them know that they're in a great place and that we're going to take really good care of them here at Children's Hospital San Antonio.
Showing the compassion that we feel and proving them that we are there for them.
I believe that teamwork is the most important part. On our special medicine unit, we work exclusively with physical, occupational, and speech therapists, along with RTs for our special patients who need extra care getting around everywhere. Without the excellent teamwork that our unit has, I don't think that we would be such a success.
We work as a team, as our medical assistants, nursing staff, social workers, physicians, and administrators.
Working as a team to give our patients the best care.
On the unit, we have a team of skilled geriatricians, educated nurses, dietitians, pharmacists, and case managers that meet every day and in order to provide holistic care for our patients and families.
Part of teamwork is incorporating all the nurses, doctors, radiology techs, respiratory therapy, housekeeping. We all need to work as a team to provide the best patient outcome.
Within women's services, family-centered care is so very important to us. A new group, a new family, bringing that baby into that mommy's arms, onto that mommy's belly right after the baby's born is one of the most beautiful experiences. Seeing her give her baby nutrition for the first time by breastfeeding, or however she chooses, or they, the family group, chooses as a family to do.
It's important for us that we provide holistic care that is culturally competent for our patients. We notice that when we do this and we incorporate the patient's diversity into our care plan, that patient satisfactions go up.
Well, here at Christus, we do care for the patient and also for the families.
We have to listen to our patients, and not just our little patients. We got to listen to the adolescents and the families, the grandparents, the mom and dad, the siblings that may be in the room with them, and what their observations are for the patient.
Christus is the philosophy that we live by here, family-centered care.
You know, our commitment to care for patients and families and to do whatever we can to help them recover from whatever they're suffering from and to move back to the best place they can be from a health point of view.
I'm Kadrian Tisdale, and we are Christus.
Hi, I'm Monica Huerta, and we are Christus Santa Rosa.
My name is Vanessa Esquivel, and we are Christus.
My name is Teresa Mangold, and we are Christus.
I'm Juliana Armacholo, and we're Christus.
I am Rosa Carrasco, and we are Christus.
My name is Katie Monahan, and we are Christus.
I am Rachel Hearn, and we are Christus.
We are